Yo, what is that gigantic hole? My name is Dr. Ma and I'm a dentist. Welcome to case review with me, okay? One case, everyone knows the rules. So what do we have here? We have what appears to be a lower molar tooth with a gigantic, huge, big cavity, which is in the occlusal surface, okay? Occlusal surface, simply a term indicating the surface that we chew or eat on, okay? So the occlusal surface of this molar is quite an extensive cavity. It's even approaching the buccal grooves, buccal as in towards the cheek, and the lingual grooves towards the tongue. As you can, I don't know if you can see, but there's the tongue behind that tooth, and it's really extending in all directions, basically mesial, distal, buccal, and lingual. I don't want to use too much jargon. Appears to be also a deep a cavity with a lot of decays, and a lot of it what appears to be also active decay. How do we know? So from the texture, it looks soft and crumbly like this, as in someone can remove it with an instrument called a spoon excavator. Of course, there are other instruments that we use that I'm going to talk about. So what about a treatment for a case like this? Of course, a clinical presentation is not enough. We would need to look at an x-ray. Also helps us identify how deep is this cavity. Is it in close proximity to the pulp, which a lot of you call the nerve, but actually it encompasses things more than just a nerve. Okay, we have vascular supply in the pulp. Also, there are cells. There are many things in the pulp of the tooth. So also we have stains in the groove of that tooth. With regard to treatment, as I told you, we'll get thorough assessment, which can include a clinical exam, the x-ray investigation, also certain tests such as pulp test or cold test. If the tooth is vital, meaning still alive, and the cavity is it's manageable with drilling and filling, we could do that. However, if the cavity is too extensive and extending into the actual pulp of the tooth, then that may need, if it's literally extending to the pulp of the tooth, then there's a very high likelihood the tooth will need a root canal. Alternative option, you may be surprised, but if the patient refuses root canal and the cavity is extensive like this, I mean, like the other option would literally be exo or removal, but which was just like really not advocated at all in this case. The removal would rather go for if it's too deep that it needs a root canal and build up again. Okay, case review, one case. Thank you everyone for watching. Peace.